how is a diagnosis made for back and neck hernias? Yes, with back hernias and neck hernias, it's probably impossible not to have a hernia among these. Since the topics are connected, let me say this right away. The best treatment for a hernia is playing. Play it too. Let's play. What do you mean, what to play? A motivation. That is, stress takes away the discomfort. That was heavy. The primary cause of hernia is stress. I mean, the environments we live in, events and incidents all put a huge burden on the spine, leading us to ultimately face hernia. So it provides morale and motivation. As we said, the main cause of arthritis is inactivity. Throughout the day, we might be using many joints, but the lower back and neck areas are the least active parts of our body. But if you pay attention, if you think about every region, every part of us is dancing, from our dance tunes, from our instruments, from our cheng. For example, the area we move the most, including our hips, is the lower back. In a way, this is a form of exercise. So, we're hitting two birds with one stone in a single move. So play a lot. Play a lot. Beautiful teacher. May God make you laugh. Apparently, those heavy non-dancers end up with the most hernias. Yes, yes. For example, it's forbidden for all my patients to sit for more than an hour. More than an hour. But teacher, I can't sit anywhere. Of course, you shouldn't sit. Human beings were created for sitting, for inertia, for laziness. The mechanism is for movement. You know, there's a verse that says, if you get tired in one job, move on to another. It doesn't say go sit, down, rest, lie down, for example. The one who created this body has explained this to us. That's why working is actually the biggest activity. So, what do we always say? Exercise is one of the most fundamental activities that protects us, protects our joints, and prevents calcification. Let's say we have a hernia. How do we diagnose is it correct? Now, there are degrees of hernias. First of all, what do we do when we say back pain? We're not missing it. That's correct. If you just brush off back pain, it will catch up with you. It's the most insidious ailment. Lumbar hernia and cervical hernia are the most cunning disease. It's cunning. So, you're suffering from back pain. Lying down for 3 days, 5 days, a week. You take painkillers from here and there, and then after a week or 10 days, you just go on with your life as if nothing happened. You don't even care about what happened to me, correct? Now, for example, I'm going to tell you something. You set an alarm for the house, God forbid. There's audacity theft. You set the alarm, in the middle of the night, the alarm went off. What are you doing? What is your first move? You get up and turn off the alarm. Anyone turning off the alarm? What are you doing? So why did this alarm go off? Is that right? Did a cat come in? Did a thief come in? Did a thief come in? Then you see that the window is open, a cat has come in, and the alarm went off. Giving example. You're chasing the cat, turning off the alarm, and if your mind is at ease, you go back to sleep. That's it. Pain is the body's. It's an alarm, not knowing the reason, and just turning off the alarm. Let's say you took a painkiller, you took something, the alarm stopped. But what happened? Why did you feel pain? It's the same position. The person in the story I told is someone who couldn't prove or understand the reason for their pain. It's the same thing. So, there will be herniated pain, will pass. Especially first-degree hernias cause constant back pain. You will have back pain. The hernia has started. It's at a beginner level, and eventually it will knock on your door at certain intervals. But it doesn't stop. She has gone to sleep. It's about to wake up from hibernation. And one day, you wake up and there's something in your hip. So there's someone behind me. It keeps stabbing me, sir. Those who are living it right now know it well. There's constantly someone there. It's stabbing me here. It's stabbing me, sir. Is that right? Yes, look, he says. And actually, this story doesn't just stay in that moment. It's a process. As long as the displacement continues, that is, as long as the hernia continues, as long as it continues to invade the nerve canal, the pain gradually stops spreading down to our leg. If you're experiencing leg pain, look, if there's pain in your hip, it means you're living with a second-degree hernia. If this pain has started to shoot down to your foot, then good luck, because a third-degree hernia is at your door. The slipping is continuing, and the nerve, God forbid, our country is experiencing it, it has experienced it. How do souls remain under the rubble of an earthquake? Is that right? The nerve is also trying to survive under that rubble. It's fighting for survival. So, as the process continues, as the rubble grows, and as it progresses towards the fourth degree, the problems intensify and invade your life. Teacher, I've reached a point where I can't even stir soup for my child for 10 minutes. I'm standing, I can't stand it. Teacher, it feels like I'm walking on fire. It feels like I'm walking on shards of glass. Numbness, burning, tingling. All of these will gradually start to invade your life. This is a story, it's not a novel. True. And now you have dreams without me, without knowing about me. You say how beautiful they were. then it wakes you up at night. Why person wake up at night? I mean, they wake up for their child, right? Virus crying for child, or for their illness. A disease that wakes you up at night is a severe illness. It's a troubling situation. It will even take away your sleep. This is an invasion, a disease that slowly, stealthily, without you noticing or taking it seriously, invades every part of your life without waking you up. Why it's the most insidious disease. I call it the most cunning disease. Over time, what was I like 3 years ago, 2 years ago? I used to run and play in the fields and hills with my kids. I used to play ball. I would walk for miles holding my grandchildren's hands. I used to do it, but now I can't even move from room to room. My friends are inviting me, but I can't go down for coffee. Well, it seems like we can't even have a cup of tea anymore. The whole process just keeps moving forward. Look, we are going to diagnose a severe hernia now. I'm showing you right away. We will diagnose a severe hernia together. You came to us with these stories. Doctor, I have pain in my lower back. It's radiating to my hip, and I have numbness and tingling. I'm having spasms, cramps. It's also starting to wake me up from my sleep. Here is the diagnosis of your hernia. Look, I brought you an MRI. And in this MRI, you can see your lower back from the side. You're standing like this. We are looking at things from the side. So this is our spine. If you can zoom in a bit, this is the abdominal area. The abdominal area. Below this is the hip. Look, this is the lumbar part of our spine. And there are 5 vertebrae here. 5, 4, 3, 2, 1. These are our discs, our joints, you see, right? This is what a healthy disc looks like, see? Let's zoom in a bit. A healthy disc. By the way, doctor. Yes, yes, I see. A healthy disc looks like this. It should be white inside. Look, it should be white inside. I want to show Uğur Bey's MRI one day. Show it to me one day. Mine are never white. Mine have always been dark. So how dark are we going to look at it? I want to show it one day. Why have they turned dark? Yes, these are it. These have been, it's been dehydrated? Dehydrated. Well, yes, it has been under compression. And herniations have occurred. This is degeneration. It's a first-degree degeneration. The inside has turned black, but there's no bulging towards the canal. Look, our nerve is passing through this white area. This is the main electrical line of the body, the main nerve line. All the electricity is distributed to the body from here. Look, it's only first degree, but can you take a look at this? Not only has it turned dark, but it has also shifted towards the canal and completely blocked it. Cut off electricity. Yes, well done. So from here down, it's getting harder for the electricity to flow. A 4th degree hernia, which is extremely severe, you know, only those who experience this pain truly understand. Those of you at the screen know, do you know what it is? So I guess a Havanur was born. I don't know how she did it, but it's labor pain. Congratulations to her too. Take it in your healthy hand. Wait here, teacher. Yes, the whole program. It's 3 times the pain of labor. Dear friends, this nerve pain is the most intense pain a person can endure. Everyone has experienced toothache. We don't know what labor pain feels like. Mothers know. We all know what a toothache feels like. It's 3 times worse than a toothache, dear friends. Look, there is no pain like this. In fact, when a hernia reaches this level, I tell the doctor to just cut off my leg. It's that intense. It has progressed that much. Even during these times, we are no longer hopeless. We are not hopeless. Technology is advancing and our experiences are progressing. Even a hernia during these times can be treated more comfortably with daily treatments rather than heavy therapies, and we can help you recover from hernias. What are those treatment methods? Especially robotic laser treatment. Yes, look, there's a model here. So, this is a model of our nerve. If you show it up close, our nerve passes through here. Look, it goes through the canal and our disc has been removed. Our disc slips and ends up compressing the nerve underneath it. So this is what we call a hernia. Now you've learned about it. What's important for us at this point is to make the correct diagnosis. And a hernia has its own age. Just like we all have an age, a hernia has its own age. Fresh hernias that haven't been delayed or postponed are extremely valuable to us. Now we have most of these. We can easily get rid of it without surgery. So, my request to you is not to allow this sneaky invasion to take over, not to let it take away your life and comfort, and to consult a doctor as soon as possible to find out what your hernia is, what level it is at, and how it is pressing on which nerve. That's why I especially urge you not to delay and not to wait until nerve damage occurs, because the techniques and treatment methods we have are extremely valuable. That's why I'm especially asking you not to delay and not to wait until nerve damage occurs. Because the techniques and treatment methods we have are extremely valuable. When I first started my specialization and was performing surgeries, we used to use loupes. I mean glasses. There was no microscope. So 20 years ago, we were also in the early stages. We used loupe. We used to wear glasses. In the past, of course, open surgeries for such a hernia would involve incisions of about 10 centimeters. Of course, they have shrunk. We used to wear glasses to see the hernia. In fact, when the nurse would hand us a tool, we couldn't adjust our glasses. When we looked at it, we couldn't see it. Of course, we take our devices without looking. That's our habit. We had to keep our heads at that angle. In fact, many of us would end up with a hernia because of this, because we would stay for hours, for minutes, with glasses adjusted to maintain the distance and to see that distance. Now, microscopes have entered our lives in the last 20 years. In terms of surgeries, now we can operate from a tiny spot, just 1 centimeter, and magnify that area 40 times, allowing us to see the nerve clearly and know exactly what we're doing. Then the endoscopic or minimally invasive surgeries have now come into our world. They also have their advantages and disadvantages. However, especially after physical therapy, in patients where no results can be achieved with physical therapy, we now have interventional techniques, meaning robotic laser technology. With regression methods, we can now treat hernias without making any incisions or cuts. Look, we don't have a patient admission. We don't have patient admissions. Is it easy, doctor, to cut and operate? Absolutely. I remember those times to some extent. I'm saying this as someone who has been interested in neurosurgery since university. They would put the hernia patient in a full body cast, 360 degrees. We used to call it a full body cast. And they would keep them in bed for 3 months. Look, the world has seen these things. Can I have a hernia? But now we have reached the point where we can do it with 15-minute methods. And very advanced technologies such as robotic laser technology. The major existing issues instantly. So that day you come in on a stretcher, and I experience this every day, and you leave walking. Doctor, where do you say your pain is? It is nice that this very serious technology and our experience have created such a successful net success rate of 93% to 94%. Treatment methods are increasing every day. I'm even having a hard time keeping up. This is my only job. I've dedicated myself to this field. So, at this point, I'm constantly reading. We are constantly holding think tanks, conferences, congresses, and so on. It's very important. It's progressing. So maybe in 3 to 5 years, we won't even be talking about many of these things anymore. In fact, there are even things like hernia vaccines on the agenda right now, like producing collagen, high-quality collagen, for example, which is one of our biggest problems. I'm sorry about that, doctor. Of course, not all of us can produce quality collagen. Our genes are like this. No matter how hard we try, we can't give it to our genes. Because there are no quality products, that is, our food is synthetic, our life is aesthetic, and we are a little distant from the natural life, our collagen levels. It's beneficial to support them. Thank you very much, doctor. Thank you. We have our operator, Dr. Fatih Kırar. We thank him.